Shame is, I consider it a social trauma disorder, social trauma syndrome. So it's very similar to PTSD. When you have post-traumatic stress syndrome, you become hypervigilant to the cues around you, the environment around you. Let's say someone walks into a restaurant and they sit facing the door, they look to see where all the exits are. What happens when we've had social trauma, relational trauma with other people who've judged us, who have harmed us, ridiculed us, exiled us, withdrew love from us, we begin to get hyper vigilant on what other people are thinking. So like that person walking into the restaurant, we walk into the room. Who's here? What are they thinking? What are they feeling? Are they approving of me? Are they disapproving of me? So you become very hypervigilant to the people's opinions and thoughts, perceptions about us. And one of the characteristics of toxic shame is appearance management. Mm-hmm. You're managing that appearance to make sure that you never, ever again experience that level of shame from another person. So just like PTSD, we can get triggered, we can get activated in the right circumstances with all of the correct variables falling into place. And when that happens, we are likely to become very sensitive to what other people are thinking and likely to perceive them as being critical and judgmental, because that is often the experience that people have.
So how does someone work to stop those thoughts?
So many people come to therapy and are in this journey and they say, how do I stop this? I want to stop this thought, stop this shame. And what I say is that we're not going to stop it. If this has been something you've ever thought, felt, experienced, then it is on your conveyor belt of life. Mm-hmm. It may not always be in your conscious awareness. It may not always be so activated.
But we can always get triggered.
We can get triggered, and yes. It's like it comes, it's like the luggage at the airport. You know, that conveyor belt can be empty for a while, but all of a sudden that suitcase comes when it's called.
Well, I want to really talk about this for a moment. And I know we're almost out of time, but that is such a good point, because I think once we overcome something or feel like we have reached a certain level of recovery, and then maybe years go by and then all of a sudden it shows back up, we can almost have a shame response for having to deal with that thing.
Why is this happening now? I did all this work, and what does it mean about me?
Yeah.
Really what the first step is we're separating their identity from the struggle. And so what we say is that when it comes to your mind, we just want to observe it, see it, and let it flow. Mm-hmm. It flows into the mind, it flows out of the mind, and not let it be so sticky. So we don't want to resist it. Why is this happening? I don't want it to happen. And we don't want to cling to it by identifying with it, ruminating with it, but just being in flow, letting it come through you like wind going through the air. And then regroup, get mindful about the here and now. Like Paul was saying, you know, I want you to be present in this second, in this moment, in this day. Bring all your awareness to today.
Yeah, because to go 4 years into the future is overwhelming for anybody to try to think, how am I even going to get there? Well, you're going to get there one moment at a time. We could talk all day, but we do have to go. I just want to thank you for joining me in this journey of Uncovered. We're going to be sharing so many more stories and answering questions, and all of the stories that you see on the show, the questions that we ask, are sourced from storiesuncovered.com. So Dr. Shawn, thank you for being here. And we just thank you so much for watching.
And remember, there is always hope, and healing is possible.
That's right. And no matter what the voice of shame might be telling you, I promise you, you are not alone in your struggle.